Hi, this is Dr. Paul with Car Injury Care TV, where we answer the most common questions about car accident injuries. And we're speaking with Dr. Nick Venturino here in North Tampa. And the question is today, how not to have a permanent injury after an automobile accident. So let's go ahead and talk about that a little bit. And I guess really, if you could just give us a brief on what causes a permanent injury to begin with. So can we talk about that first?
Sure. Permanent injuries are caused when the body heals abnormally, whatever the stimulus. Your body's always going to heal itself. Whether it heals properly or improperly is what determines whether you have permanent damage or not. Your body goes through 3 phases of healing, but it's whether or not you get to them quick enough and do the right types of treatment that dictates whether it heals normally and there is no permanent damage, or it does not heal normally and then you're stuck.
Well, let's go into details. So you say there's 3 phases of healing. So the first phase is
Inflammation.
Okay. So how could that possibly cause a permanent injury if that's not treated properly?
Your body goes through inflammation to protect itself, but everything that we do in the beginning stages of our treatment is to stop the inflammation, because your body won't start healing normally until this inflammation is stopped. So our goal as quickly as possible is to stop the inflammation so that we can get into the repair phase and have an effect on how the normal healthy tissue would heal.
Okay, so what I'm hearing you saying is the inflammation, you need to decrease the inflammation so the body can start healing.
Correct.
And then that's really when you're going to start having an impact on it.
Correct.
So what specifically happens in this repair phase that will cause a permanent injury?
There's 4 components to abnormal healing. When collagen fibers are torn, which is pretty much any of your tissue, when those fibers get torn, they have to, the fibers themselves are only 80% as strong as normal healthy tissue. So if they're weaker, they're naturally going to predispose you to be injured easier.
So if you don't do anything, you'll naturally be 20% weaker.
Correct.
If you don't, okay.
Which is going to make it easier for you to get hurt over and over and
Again,
over.
okay, that makes sense. So that's number 1. What's number 2?
2 is it's less elastic because of the way the fibers line up. They're not lined up linear. They're lined up crossed or more like a lattice, and so they're much less flexible.
Okay. And so in the patient will just feel, I take it,
Stiff.
more stiff.
Yeah.
Okay.
Feel old.
Okay. That makes sense. And matter of fact, you hear people say that all the time. I just feel stiff and old. By the way, is that what causes that right there?
Absolutely.
Yeah. Oh. The third component in the repair phase is what?
It's hyperinnervation, meaning because of the way the fibers line up incorrectly, the body doesn't function as well in that area, so it puts more nerve fibers into that area to deal with the improper healing. Obviously, with more nerves, it's going to be easier to feel pain because there's more nerves there to feel the pain.
Okay, so what I'm hearing you saying is this collagen fiber gets mixed up, it's a mesh, and the nerve endings get tangled in there essentially, and now there's an increase in the number of nerves.
Right.
So that'll create more pain, and then the fourth component is what?
Those nerves will have a lower threshold.
Meaning what?
It takes less of a stimulus to cause them to feel pain.
Okay. So if you don't get any type of physical medicine during that repair phase, are you telling me you can expect all 4 of those?
You can expect to be weaker, stiff and less flexible, feel pain easier, and have less of a cause to make you feel that pain.
It sounds like you just described a lot of people.
Sure.
With old injuries.
Part of aging. We call it normal aging. When it's abnormal healing is what's really the problem.
Okay. All right. Now, how can you, as a chiropractor, change that?
Well, the specifics with chiropractic is we're the only profession that works on actually correcting the structure. So with the gentle manipulation that we do, we can help impact all 4 of those components so that the body will heal more normally.
Let's go into each one. So what does a chiropractic adjustment do to the first one, which was, you said, it decreased strength. How does a chiropractic adjustment affect that?
The strength is predicated, or the loss of strength is predicated on how this tissue has been damaged and the fibers don't line up normally, don't line up linear. So if we can adjust the tissue, realign those fibers, they're going to line up more linear and be stronger as a result.
That makes sense. Okay, number two. What you said number two was
Elasticity.
elasticity. Okay. How does a chiropractic treatment help increase or restore somebody's elasticity?
When you think about how the body moves, again, we're the only profession that deals with all three planes of movement, which is your passive movement, how far you can move on your own, active movement, which is how far you can move on your own, passive movement, which is how far I can make you move after you've moved as far as you can on your own, and then you go into a whole nother level of movement, which is at a much deeper joint level. And again, we're the only ones that do gentle manipulation, so we can actually impact how much movement by correcting at a deep joint level the normal movement.
So you're saying there's three ranges of movement: active range of motion, you said, passive range of motion, and what would you call the last one? Joint motion, or?
Well, extra joint motion.
Okay. And you're saying chiropractors. Well, how do other practitioners of physical medicine fall into those categories?
They all treat the two common. Your active movement,
Okay.
and then their passive moving you a little further.
Okay.
But they never get into what's called the physiological range, which is that deep joint movement.
And how does that impact the flexibility or the elasticity of that joint?
If you stretch the muscle, you'll get it to move better. If I stretch your tight neck, it'll move better. But if the joint is still locked up, if there's still compression in the joint, it can only move so far because the joint is stopping that movement, not the muscle.
Okay.
We go in and take the pressure off the joint, so now naturally your active movement's going to be further. So your passive movement will be
Okay.
further
That makes
because
sense.
we're going deep at the joint level.
Okay. And then you said the third component of not healing wrong is,
Hyperinnervation.
and how does chiropractic stop hyperinnervation?
Well, when the nerves, when the collagen fibers get twisted and in abnormal alignment, the body just naturally tells them, it gets a little confused and tells the body to produce more nerves there. So if we can cause with, again, we talk about how the general adjustment aligns things properly, it keeps it from getting twisted, and you don't create any new nerves in that area.
Okay, so I'm hearing you say that the tissue is not as tangled as much, so there's not as many nerve endings in that tissue, therefore it's not as painful.
Correct.
Is that what you're saying?
Correct.
Okay, and you said the last one was what? Nerve sensitivity, I think you said?
How
or-
sensitive the nerve is.
And how does chiropractic affect that?
And again, if we can reset, if we can correct the alignment of the tissue, the body will reset its normal gauge. So if it normally takes, let's say, 10 pounds of pressure, whatever that is, 10 pounds of pressure, before you'll feel pain, if the fibers aren't lined up properly, it may only take 7 pounds of pressure for you to feel pain.
Right.
But if we can correct the alignment in that tissue, then the body resets those nerves to fire at that normal 10
And
pound.
chiropractic can do that.
Absolutely.
And so, okay, well, that makes sense. That clarifies that. And then the last phase of healing you said was what?
Remodeling.
And so what happens in the remodeling phase, and how can chiropractic stop that from healing wrong?
Well, the remodeling phase is how your body sort of gets used to this abnormal healing that takes place, and it is ultimately, after 6 to 12 months of not healing normal, it's pretty much how your body gets used to dealing with this abnormal healing.
Okay.
So if we can get to that tissue early enough and we can start to have it heal more correctly, then the remodeling phase, it's learning to deal with normal healthy tissue, normal movement, normal strength, the normal amount of nerves and the normal firing threshold. Then the body is functioning more normally, and there's much less of an impact or much less abnormal function that can be expected as a result.
That makes sense. So in a sense, that's how chiropractic can prevent somebody from healing abnormal or wrong.
Correct.
That's okay. That's good. Very good. I've never heard it explained in that kind of detail. Again, this is Dr. Paul with Car Injury Care TV, and Dr. Venturino has put together over 50 videos of common car injury questions and answers. They're totally free. If you've been in an automobile accident or injury, feel free to go over and pick them up.